You're still on to Friday's edition of Morning Ride. Right here in this segment, it's time for our interview. But we have an expert that will be doing justice to the topic we'll be discussing. Well, we'll be discussing on World Dentist Day, which is celebrated or commemorated today, why your dental health matters. Now, we have an expert in the house who is no other person than Dr. Osasunwen Zeno Obon, who is a dental surgeon, yes, with a Bachelor of Dental Surgery degree from the University of Benin City. Good morning, doctor.
Good morning.
Welcome.
Good morning. Nice
Good
to have
morning.
you here.
Good to have you.
Good morning. So it's not out of place for me to say Happy World Dentist Day.
Thank you. I appreciate that. Thank you.
Okay, so let's start from the idea of dental health.
Right.
You know, it's one subject that the average Nigerian may not pay much attention to, but this is a very, very pivotal aspect of our life. So can you speak to this very quickly?
All right. Good morning, everyone. Thank you so much. Happy World Dentist Day to me. So yes, I was speaking on dental health. Thank you very much for that question, by the way.
Yeah.
So yes, I came across a post yesterday, and someone talked about how they lost a patient to poor oral hygiene, and everybody in the comment section was confused, wondering how is this possible, you know. And I saw a lot of people commenting, and there was nobody to enlighten them about these things. Now, I will just give a little summary about how important our oral health is. As every other infection or every other disease in the body, different forms of infection can be a pathway to problems in the body. So take, for example, you have a caries or a cavity or a hole.
I'm sorry,
in your tooth.
sorry, I think, okay, a hole, because I wanted you to use like the layman's
Okay.
English, because
All
someone
right.
would say, what is a caries?
Oh,
Exactly.
okay. All right, my bad. So yes, someone has hole in their teeth, and to them it's just a hole. I'll take medications and
Right.
it goes. Now this hole is a portal of entry for infections. Bacteria goes into your teeth, and within the teeth is a blood vessel. Within those blood vessels, the channels are carried. The infection is carried within those channels into the bloodstream.
Yeah.
Now, mind you, the teeth is not hanging on air. The teeth is actually in your jaw. And within the jaw, you also have other blood vessels. Now, what happens is when a patient doesn't seek dental care, this disease starts to progress and goes beyond the teeth into the system. Before you know it, the patient comes down with swelling. And most times, Nigerians don't present. To them, they believe that, oh, when they take herbals, they will be okay. Now, that swelling progresses even further. Because now, the swelling, because of the position of the oral cavity, it is close to our airway. It's also close to the heart. So now this swelling can cause airway obstruction. You see a patient gasping for breath, and they are dead within few minutes. Sometimes a patient can have sepsis, whereby sepsis is basically an infection of the blood. And then this patient has septic shock, the system shut down, and the patient is gone.
This sepsis you just talked about now, is it affected or is it linked to our teeth?
And that is the thing. Infection, you could have an injury on your body.
Mm-hmm.
And then infection, bacteria goes in through that portal and enters the bloodstream.
Okay.
Likewise, through oral infections, from your teeth, from your gums, the blood is also flowing in those organs. And so therefore, once this bacteria goes in through that portal, it gets into the bloodstream and causes sepsis. It doesn't have to come from your stomach, it doesn't have to come from your leg, anything. And a lot of people don't know how bad and how dangerous dental infections can be. And so because of this, there is so much lack of knowledge on this topic, and that's why I was so grateful when I was invited here to speak on it today.
Well, very quickly, there are
Yes.
lots of dental mistakes that lots of people make. Like the average, like I said earlier, the average Nigerian, we are used to, it's an anomaly that's become a norm that we self-medicate.
Yes.
So most times when we have a swelling on our gum and all of that, we see us gargling things like salt water, clove water, the list is endless. So what are some of these mistakes that we make when it comes to our oral health, our dental health, and so that I think we should speak to also that
Yes.
should we come in contact with these, we'll be able to sensitize people and then we don't even fall into the traps of all of these mistakes.
All right. So yes, One of such mistakes, in fact, the very first and most common, are these dental powders people buy in the market. They are the worst things you can do to yourself. Now, what these dental powders does is this. Within the teeth, there's a structure called the pulp, which contains nerves and blood vessels. So what this dental powder does is it kills the nerves within the teeth. But what they don't know is that once you have killed the nerve, the infection spreads faster. And so most times they'll complain, they'll say, oh, I'm not feeling the pain anymore. And before you know it, it has gotten into the jaw and it has traveled further. That's one. Two, people use all sorts of things for their oral hygiene. We always advise use toothbrush and a fluoride toothpaste for brushing. But Nigerians would rather use things like chewing stick. People would use all sorts of things, but the ideal. Another thing people use that is not good for your dental hygiene is toothpick. Many people do not realize that toothpick causes gum diseases.
You said chewing stick. Are chewing stick bad?
Chewing stick is not ideal for oral hygiene. It doesn't clean like it should. There are
Okay.
debts that stick in between your teeth. There are debts that stick on the teeth.
So in that aspect, what do we use for the in between our teeth?
You use a dental floss.
Floss. Okay,
Yes.
Great.
Because a lot of people just let it stay there. And what it does is that microorganisms break down that thing stuck within your teeth and causes holes.
Right.
So those are things that can also cause holes, predispose a patient to having holes in their teeth. So I talked about chewing stick, I talked about dental powder,
Toothpick.
I talked about toothpick. Another thing people do not realize is that the technique of their brushing matters. Some people just do anything they want to do. Some do very rough brushing.
Okay, so I want you to put a pause on that. So
Okay.
I need you to take this technique very well, because I was thinking my partner will ask about it, or I'll ask about it.
Right.
What is the proper technique for brushing our teeth?
Right.
Like the proper technique. I just want, if you can demonstrate it, it's going to be awesome.
Okay, I
Yes.
don't have a model here, but I will
Yes.
try my best to explain.
Okay.
So when you want to brush your teeth,
Yes.
your toothbrush in your hand,
Yes.
for your upper teeth, when you're going back, you know, the way, first of all, the type of toothbrush you use matters.
Okay.
You do not want a fat-headed toothbrush. You want a toothbrush that tapers towards the tip.
So what kind of
Reason-
bristles should we get now?
Medium bristles, and then the head of the toothbrush should taper inward.
Great.
Reasons being that as your mouth goes inside, it narrows.
Yes.
So most times when people use fat toothbrushes, it doesn't get to the end.
The extra.
Right.
Soft
So-
or hard?
No, medium.
Medium.
Yes.
I
Okay.
can't even do medium. I do soft.
Fine.
Okay, so medium
Or
or
medium
soft?
is the ideal, yes.
Okay, great.
And then,
I'm learning.
yes. And then your toothbrush in your hand for the posterior upper, you sweep out. You don't do forward, backward.
So it's this
You-
way.
Yes, so you
This
sweep
way,
out.
so up, down.
Good. So
Okay.
your bristles can go into your gum, take out some particles that are there, and sweep it out. It sweeps out, it sweeps out, it sweeps out. The same motion for the front. While for the down, you take it upwards.
Upward.
You sweep up, you sweep up. And then for the biting surfaces, we call them the occlusal surfaces, you can scrub lightly on them. When you do this, you combine with your flossing, and you are dedicated to twice daily at least. You're good to have.
To brush twice a day.
Yes, twice a day.
Okay.
First thing in the morning after breakfast, last thing in the night before going to bed.
Great.
Okay. So I actually wanted you to land, and I won't lie, I got scared at that point when you said someone actually died because of toothache. And I'm just thinking, because I know someone that has this hole in his teeth for a
Yes.
very long time and has not even gone to see the dentist. So my mind is just going here and there. All right. Today is actually a very special day,
Yeah.
like my co-anchor said, which is the National Dentist Day.
Yes.
While World Oral Health Day follows shortly on March 20, and you
Yes.
said that also. And now the 2026 global theme says, a happy mouth is a happy life.
Great.
Now let's narrow it down. This thing, which is a happy mouth is a happy life, how does one's oral health specifically impact her mental or his mental confidence?
Good. I like that. So oftentimes the mouth is usually overlooked because how bad can it be? But what I have come to realize is that thing says it. We have, when patients present at our hospitals or our clinics, they can't sleep. They lose their mind, they can't do anything. The dental ache is so much, they can't function well, they can't chew. And you know, when you can't eat your favorite meals, you are not happy. You know, people, there are people who have missing teeth, they don't have their posterior teeth where they can chew. They are not happy. Some, they've done procedures like root canal treatment, where they are advised not to, you know, as Nigerians, we love hard things. So we are being advised not to chew,
bone.
not to crack
Exactly.
bone.
No,
So
not
you
to
see,
crack bone.
you see, exactly. So a lot of times you see them, they are always like, oh no, I can't, oh, doctor, I cannot leave this one. No, it's this particular one I enjoy, you know. Sometimes even these things we eat, they affect us because you can be cracking a bone in a seemingly healthy tooth and the tooth breaks, you know. So, and generally, let's even leave the teeth. Within the mouth, we have other structures like the tongue.
Yes.
Someone has bad breath. They are not confident. They go out there, they are always watching their back, wondering how people feel about it. And that's also another bad thing. You have mouth odor, you're trying to treat with all sorts of things that could even be worsening your health. Most times, mouth odor may not necessarily mean that, oh, you're not brushing well or you're not sticking to the ideal. It could be an indication of something else. It could be you have a systemic disease, because yes, systemic diseases present in different ways. And one of such is bad breath.
Bad breath.
Yes. Then also the kind of food we consume, things like milk,
Contributes.
yes, sulfur-containing foods like onions, eggs. There are things that can predispose a patient to have bad odor. So imagine someone, you talk like public presenters, you're speaking and everybody's turning their face away. It affects your mental well-being. It makes you feel less confident in yourself. And let's even talk about aesthetics. Your teeth is scattered, you know, people have funny colors of teeth, and they're not proud to smile. They are not proud to, you know, talk in public. You see some people, when they are talking, they're trying their best to...
Scattered teeth can be arranged, right?
It
braces?
can.
With
Yes,
braces.
with orthodontic treatment actually. Braces is just a part of the
Okay,
treatment.
just a part of the
Yes.
treatment.
Okay, so you said something about brushing our teeth. You said morning and night. That's twice daily
Yes,
when we wake
I
up in
think
the morning and then before we sleep. Well, there's something that's in vogue. I don't know, maybe it's not new to you because you've been in the world of dentistry for probably a long time, but it's now beginning to be in vogue. What people call tongue scrapers.
Okay.
Please, I need you to speak to that because there's been different opinions. Some people will say, when did tongue scrapers come out? Did our parents know what tongue scrapers is? And it's now beginning to be in vogue. And you know, some people have given practical examples of how to use these tongue scrapers and all of that. So please, can you
Yes.
quickly speak to that and its importance? And while you speak about that, please quickly speak to the aspect of using charcoal. Because we have charcoal toothpaste, and people are saying we are now drifting back to the ways of our fathers that used charcoal in teeth whitening. So can you speak to both of them quickly, please?
Okay, so
Yeah.
thank you. I will start with the tongue scrapers. So tongue scrapers aren't entirely bad, but the market has been infiltrated with a lot of terrible things. So a tongue scraper, ideally, it's best prescribed by your periodontist or your
Okay.
dentist generally.
Okay.
Yes. I would rather a patient sees a dentist first.
Before using a tongue
Yes,
scraper.
before using
Why
a
is
tongue
that
scraper.
though?
Yes, because like I said, the market has been infiltrated with a lot of tubes and a lot of things that are not ideal for you. You may be thinking it is doing the job of a tongue scraper. However, it is taking out even more important things because in your tongue you have healthy bacteria and other things of importance there. So we do not want any issues with that microbiome.
How about the
Okay.
charcoal?
Oh,
The
my bad.
aspect of the
Yes.
charcoal.
So for the charcoal, you know, science is beginning to look into it, but there are no confirmations yet.
Okay.
So usually, as specialists, we really don't speak on what science hasn't actively.
Okay,
Yes.
great.
Personally, in the clinic, I will tell you fluoride. Fluoride is the most important element for your tooth development.
So fluoride toothpaste.
Fluoride toothpaste only. Please leave charcoal. Charcoal is not doing anything for you. It's even wearing off. It can be abrasive.
Yes.
By abrasive, I mean
Wearing
it
off
takes
your
out,
tooth
yes, the
enamel.
wearing off of your tooth, yes. So, you could have normal sound teeth, and then over time you start complaining that I'm having shock, so sensitivity, all of that. So I would advise anybody, stick with your fluoride toothpaste.
Okay.
Now, would you advise warm water,
Mm-hmm.
warm water salt therapy?
Yeah.
And how often?
So like we always say, prevention is better than cure. Right. So we would always advise visit the dentist at least twice daily. There are
Twice
some,
daily.
sorry, my bad, twice a year.
Okay.
Now, there are things that goes on in your mouth you may not be aware about, and it could be picked early, and when picked early, treatment is administered early, and it can stop progression of even worse things. Now, I'm going to give you an example. A patient presented one time, said she wanted to do scaling and polishing,
Okay.
which is the regular cleaning of your
Cleaning of the
teeth.
teeth. Yeah.
Yes, so she came for it, and then we noticed a white lesion in her mouth.
What's a
By
white lesion?
Okay, thank you. So a white lesion basically is an indication of something happening within that space. That's how mildly I can explain it. You see some white patches in funny looking ways. They could be, nodulated. By nodulated, I mean they could be pointed, or they could just be flat. In your mouth, within your cheeks, you could just notice something strange. In your tongue, you could notice something like that. So this patient presented, and
Yes.
after further investigations, because when we see things like that, we don't just want to leave them. So this patient presents, and we realized that after so many investigations, pathological findings, found that she was having a malignant lesion.
Oh.
Yes, a malignancy was already starting. And most times they will tell you for things like this that are very fatal, early detection is key, so you can arrest it. So now this person just came for regular routine checkup, and she was able to see this. So that's why we always advise that you do regular checkups, not only just for your teeth, but for the entire oral cavity, because these things are very important and they kill.
Okay.
Yes.
So how does our diet impact on our dental health?
Right. So very importantly, the kind of food we eat,
Right.
particularly carbohydrates or sugar-rich foods, are very notorious for causing caries. And by caries, I mean tooth decay.
Okay.
Good. So the kind of food we eat, also fibrous foods, like I explained earlier.
Yes.
Fibrous foods can wear down your teeth and cause teeth wear. So you have people coming out with attrition. It's usually seen more in older people. They eat all these fibrous, strong, hard food, things like tapioca, all those very strong meals, and it wears down the teeth. Over time, they are not able to bite together because now the teeth is shorter than it should. And the more it wears out, the more it exposes the inner part of your tooth that should not be out there. We also have things like I said, hard food. People wanting to chew bone, people wanting to break things with their teeth. We need to be very, very careful the way we handle our teeth.
Okay.
Because now someone is trying to break into something, and the next thing the teeth splits into two. It's not good.
So
for
can
you.
stress impact on our dental and oral health?
Yes, it can.
How
So, very good. So for a patient who is stressed, there's something we call bruxism, where it's basically a parafunctional habit. By parafunctional, it is not an ideal. So we see it a lot with patients who are stressed, either mentally, psychologically. They just teeth grinding, just They don't know.
Like gnashing of teeth?
Yes, like
Okay.
gnashing of teeth. It's just happening. You know, these are parafunctional habits we talk about. It's not ideal. And things like this not only wear off the teeth, they cause oral problems to you as well. So that's why we always say, like, take it easy on yourself. Your mental health affects your general well-being regardless of anything. So it's always very important that we take care of ourselves generally and not just orally.
Okay.
Alright.
Lilibeth, any question before we
No,
round?
thank you.
Okay, so we've been speaking with Dr. Osasunwen Zeno Obon, who is a dental surgeon with a Bachelor of Dental Surgery degree from the University of Benin, Benin City. Thank you so much, Dr. Zeno, right?
Yes.
Thank you so much for gracing our
Thank you
couch.
so
We would have
much.
loved
Thank
to
you so
keep
much.
you much longer, but time is not our friend. And then she's been speaking on the topic, commemoration of the World Dentist Day, why your dental health matters. So with these few points, you know, and all of these things she has debunked, I trust that we'll take better care of our dental, of our mouth, of our oral health. We'll take all of these things seriously. Well, it's still Friday's edition of Morning Ride. We're going to quick breather and it will be time for our next interview segment. Do stay.